again, hello and welcome to those of you who've been able to join us live. We hope for a few more folks to join us as we go along. But this is our third session of our Learning Collaborative focused on improving emergency preparedness for diabetes management. I know we had some folks sign up for this series once we started, so it could be that you may not have been able to join us for sessions 1 or 2. I'm going to have Juliet put the Google site link in the chat again. I know you've received it via email, but it's a great one-stop shop for all the resources that we've covered so far in the first couple of sessions. Thanks to those who are introducing themselves in the chat. It's especially helpful now that we have some different folks signed up. As we go forward, it's always nice to know who's in the group, and we certainly will value hearing about your experiences. We can go to the next slide. All right, so we're all pretty used to Zoom, but this setup, as we do have in a lot of learning activities, everyone's muted for now to prevent background noise. That doesn't mean we don't want to hear from you, though. Hansel will give us some information around, questions he hopes to hear your thoughts on, and there's some polls as well. But if there's a point where we're opening up things for discussion, please do come off mute. Please let us know what you're thinking. For now, though, we have lines muted if we're not speaking, just so we can focus on the material at hand. You can go to the next slide. All right, awesome. So for those of you who potentially were not in the first couple of sessions, or if you're not as familiar with the work of the Special and Vulnerable Populations Diabetes Task Force as a whole, this is a pretty large group of NTAPs, so National Training and Technical Assistance Providers. There's several learning collaboratives happening right now in the month of March, all focused on the diabetes continuum of care, but have kind of separate subtopics. So we've worked together for the past several years to address concerns related to diabetes control for a lot of these priority populations that you see on the slide. We are all HRSA funded. We have a website, chcdiabetes.org, that has a lot of the content from our previous National Learning Series, which are webinars we typically do in the fall and winter. We plan on continuing to do those, so it's a great website to check out if you want further information on diabetes management. I think we'll hopefully be able to focus on a broader chronic disease management approach going forward, but here's the context if you're interested. We can go to the next slide. So these are just some of the task force members. We don't have everyone's individual links. We'll explain just a minute the 3 groups that are organizing this learning collaborative. But if you're interested, these are all of our wonderful partners. You can go to the next slide. So yes, we have now gotten to session 3, like I mentioned at the start. All of these slides and recordings from the first 2 sessions are on that Google site. So if you've missed it, no worries. Feel free to catch up with any of the links on that Google site. Today, we're focused on patient engagement, such a crucial part in making sure that our patient populations of focus are able to be prepared, before, during, and after an emergency, especially when they're living with a chronic condition like diabetes. So we'll go to the next slide. And thanks again to those who are continuing to introduce themselves in the chat. That's so helpful. Again, for those of you who've been with us the first couple sessions, you already know this information, but those who are new, just a quick glance at those of us who are helping to facilitate this series. So we do have a couple additional team members from a few of our NTAPs here, but just wanting to let everyone know that we have Dr. Jose Leon from the National Center for Health and Public Housing. I am Ariel Mather. I'm the program manager of the National Center for Equitable Care for Elders. And today's session specifically is going to be facilitated by Hansel Ibarra, who is the health strategy specialist at MHP Salud. So again, if you're new to this series, we kind of find a way way to incorporate our various populations of focus into this content, but we get to hear specifically from Hansel today about patient engagement. So with that, I will turn it over to him and we'll get started with the rest of the presentation.
All right. Thank you, Ariel, for introducing us, for getting us all started. And also welcome everybody once more. Thank you for joining us, taking time out of your day to be part of this session with us. Next slide, please. So before we get started, I would like for you guys to keep these 3 points in mind as we go through our session. I call them the 3 Bs. And these are be present, try to put all distractions aside and engage with us. Be prepared to contribute, be ready to share. There's going to be moments where we do some polls and when we ask questions to the greater group. So be prepared to go ahead and share with us some of your ideas, some of those struggles that you've noticed or that you encounter. And also be respectful. Be sure to provide constructive criticism if you're going to respond to someone's comments. Provide another way of looking at things or a solution. Don't just simply criticize the idea. Next slide, please. Here is a little icebreaker question that I would like you all to answer either by coming off of mute or by simply placing your answer on the chat box. We're going to ask you guys to go ahead and let us know your name, your title and role, the organization that you work with. If you also want to include there the special populations that you serve. And if you can tell us 3 things that you currently don't have that would make your job easier. The purpose of this icebreaker question is to get us comfortable with sharing amongst each other. So at this moment, I go ahead and open up to the group. If anybody wants to go ahead and come off mute, let us know your name and maybe 3 things that you would like for us, that you are missing currently at your work that would help you continue moving forward. Do we have any volunteers? I see one already came up, unlimited budgets. Don't we all wish we had that, right? To be able to hire maybe more staff. It might be that you are in a health center that is currently understaffed, or that maybe you're doing other tasks that are aside from your role. Having enough funds to be able to get some other individuals to assist with that would be great. Is there any other, anyone that I would still encourage anyone to come off mute and share with us out loud at least one of those things that you have in mind. All right, that's okay. We got some of you individuals participating in the chat box. As I mentioned, feel free to drop your answer on the chat box. The purpose of this is to try to get us comfortable. I know that sometimes discussing issues might be a little bit difficult if you're not familiar with the individuals or the other people in the group. And this is what the purpose of this question is, to try to get that jitters out of the way and get us ready to contribute amongst each other. But there you go. Thank you for there you go. I see some of those answers. We have our biggest challenge is getting diabetic supplies out to our on-house populations. Oh, man. Thank you, Mark. Thank you for sharing. All right, next slide, please. So for the sessions for today, the objectives for today is going to be, we're going to understand the value of effective patient engagement in diabetes management. We are going to explore ways CHWs can be utilized to reach underserved communities during, before, and after an emergency. And we're going to go ahead and present real-life examples of CHWs being utilized in emergency preparedness. And once again, thank you all those that are continue sharing on the chat box. Next slide, please. All right. So benefits of patient engagement. Patient engagement is an important aspect of diabetes management, as it can help improve patients' outcomes, enhance the quality of care, and reduce healthcare costs. Some of the benefits of patient engagement for diabetes management include better adherence to the medication and treatment plans. An engaged individual understands their medications, when to take them, what they should combine them with, if there's any food that should be combined with, and what to avoid. These individuals are less likely to have a medical error if they are engaged in their treatment. They are also more likely to have a plan to manage their diabetes. They're more likely to have a diet in place. They're more likely to also be active and exercising, and they're more likely to be managing their weight. You also have an engaged patient also experiences lower healthcare costs due to their control of their chronic conditions. Another benefit of having an engaged patient is going to be the improved communications between the healthcare providers and their patients. When patients are engaged with their care, they are more likely to ask questions and provide feedback to their healthcare providers, leading to better communication and more collaborative relationship. They're more likely to communicate with the doctor and let them know of any adverse reaction, instead of them just stopping treatment. Situations where the individual is not very communicative with the doctor would lead to the individual, instead of letting the doctor know, hey, I'm having problems with this, they would just simply stop taking the treatment. So a patient that is engaged has that confidence to speak to their doctors and explain to them any adverse side effects that they are feeling. Patients feel included and empowered. They feel heard and have and in control of their own health. You also experience better client-provider experience. Engaged clients are more likely to have a better approval of their doctors. You also have patients that are engaged tend to go ahead and use preventive services much more. Things such as A1C test, maybe going out and getting an annual foot check, your eye exams, also having less missed appointments. Those are all advantages of having an engaged patient. Overall, someone that's engaged sees an improvement in health outcomes. When patients are engaged in their care, they are more likely to experience improved health outcomes, such as reduced blood sugar levels, lower rates of complications, and better quality of life. Next slide, please. So if being an active patient is beneficial, why do some people not engage in their management of diabetes? Individuals can be discouraged from participating in their health due to the following reasons. So maybe they have a lack of insurance. Patients who lack access to health care may have difficulty engaging their own care, as they have not regularly access to healthcare providers or the resources they need to manage their condition. Another barrier for having patient engagement is the level of health literacy that the individual has. Medical information can be hard to understand. Sometimes the information is written with medical jargon or uncommon words. Patients who have limited health literacy or who struggle to understand medical jargon may find it difficult to engage in their care. If a patient doesn't understand the instructions or their condition, they will likely disregard them. Levels might be different if the information is offered in their native language, which brings us to our next barrier, language. Many times, the information is only found in English and at times in Spanish, but these are not the only languages spoken. If information is not presented in the language that the patient is comfortable with, the probability of them using the resources diminishes. And I mentioned earlier, your health literacy might be different depending on the language. So just because an individual doesn't understand the instructions in English does not mean that that individual wouldn't understand those instructions if they were presented to them in their native language. So that in itself is a barrier on presenting the information only in English and not in the language that the individual speaks. Another barrier can be the lack of trust in the medical field. Individuals who have had negative experiences or hear of others that may have bad experiences with provider are less likely to look for care. Some populations would rather treat their problems in a holistic way and not use any Western medication. Another barrier that individuals face when trying to increase their engagement is going to be the cultural and social factors. Patients from different culture or social backgrounds may have different beliefs and attitudes towards healthcare, which can impact their engagement. Sometimes individuals tend to only engage with their healthcare providers when there's a need. CHWs can go ahead and assist and prevent and encourage these individuals to look for assistance before it is too late. There's also things such as beliefs that prevent the individual from looking for assistance, things such as familismo, where the individual will go ahead and place their family ahead of themselves. So even though they know that there's something going on and that they need to be taking care of their own health, because their family comes first over their health, they would disregard that and continue either going to work, ignoring that, because they are the breadwinners of that household. You have another barrier that is considered fatalismo. This is also when the individuals, they believe in destiny. So they feel that there is no point in them going out and looking for assistance, because it is what it is. If it's going to happen, it's going to happen. Another type of barrier that patients face that prevents them from being engaged is going to be the complex healthcare system. Things such as making appointments, finding a specialist, filling out questionnaire forms. All of those can prevent an individual from wanting to engage in their own health. You also have technology barriers. Patients who do not have access to technology, such as smartphones or computers, may have difficulty engaging in digital health tools or telehealth services. As we know, COVID-19 went ahead and moved many services now into the electronic. And if that individual doesn't have any understanding, or they don't have the tools to be able to use a computer or a phone, they might not utilize that service of telehealth. Another barrier that these individuals face is transportation. Difficulty for an individual who lives in rural areas or lack access to transportation. Even though these individuals would like to go ahead and get service because of the location that they live or the circumstance of not having a vehicle, that might prevent them from being active in their health decisions. And lastly, another type of barrier that these individuals might face is going to be time. Many times their work schedule is from sundown to sunup. So even if they wanted to go look for service, they're not able to do so because the clinics might not be open. That brings us to the hour of operations. As I mentioned, they might have all the intention to go out and look for assistance, but if your clinic is not open, if that resource is not available to them when they are, they would go ahead and stop looking for any help. And they also have lack of sick days. Many times these individuals have to struggle between going to work or missing work. Missing work can lead to them not having enough funds to be able to either pay for their light or continue purchasing groceries. So they have a tough decision of making whether I stop going to work, miss a day's paycheck to treat myself, or continue going to work because my family needs this funds. Can you all think of any barriers that prevent patients from engaging in their health other than the ones that I mentioned? So is anybody else facing other types of barriers that prevents patient engagement in your community? People get tired of managing their disease. That is correct. After them taking so much care, they feel that, hey, you know what? It doesn't matter. They can start, it maybe even falling into the fatalismo, where they start thinking, hey, it is what it is. I already have diabetes. What's the point of me taking care of this? Is there any other barriers that you guys might be encountering?
We had someone say fear as well. Mark said fear, and I think that ties in, Hansel, to what you're saying about maybe lack of trust, or if there's some other, mental health concerns too, that could definitely play a factor.
Yes, that plays a big factor, especially if the individual might not have legal status in the area. That might also prevent them from wanting to go and look for assistance because of the fear of the repercussion that might cause. I believe that is it. Okay, next slide, please. So how can we overcome these barriers? These barriers can be overcome by using community health workers. Community health workers can help address these barriers while encouraging the client to take control of their well-being. A community health worker is a frontline public health worker who is a trusted member of or has an unusual close understanding of the community that they serve. This trusting relationship enables a worker to serve as a liaison, a link, an intermediary between health and social services and the community to facilitate access to services and improve the quality and cultural competencies of service delivery. In short, because I'm sure that was a big mouthful, a community health worker is a trusted member of the community who empowers her peers through education and connections to health and social services. CHWs are trained to provide essential health services to support to individuals and communities, acting as a bridge between the community and the healthcare system. They have unique insight into the community's beliefs, stressors, challenges, and priorities. This gives them a better understanding of how to approach their neighbors and the best format to relay the information. As they are often trusted members of the community who can build strong relationships with patients, CHWs, community health workers, can touch on hard to talk issues, things such as mental health, diabetes care, and provide suggestions in a culturally appropriate manner so that the patients would accept those suggestions. Next slide, please. All right. So the following chart here shows the different core roles that a CHW covers. The C3 project developed this list of core roles and competencies by analyzing previously accepted CHW roles and competencies from the National Community Health Advisory Study and collected feedback from CHW associations and the networks across the country to develop this recommendation list of 10 roles. We will now touch on these and see how they are involved in patient engagement. So the first role that we have here is cultural mediation. CHWs allow for the clinical team to effectively communicate with their patients. CHWs build trust with patients by being relatable, empathetic, and knowledgeable. This trust can encourage patients to engage in discussion about health and seek support on guidance from the CHW. The other role that they play here is cultural appropriate education and information. CHWs conduct health promotion and disease prevention education in a manner that matches linguistically and cultural needs of participants or their community. Sometimes we forget that English and Spanish are not the only language. CHWs ensure that the information being provided is culturally appropriate. CHWs can provide education and raise awareness about diabetes, its causes, symptoms, and the importance of self-management. They can also provide information on healthy eating, physical activity, medication adherence, and glucose monitoring. CHWs can empower patients by educating them about their health and helping them develop skills to manage their current condition effectively. By doing so, patients feel more confident in managing their health, which can lead to increased engagement. The other role here is going to be care coordination, case management, or system navigation, assistance navigating the healthcare systems with things such as maybe calling the doctors, setting up appointments, providing transportations to those individuals. CHWs also ensure that the client is aware of their appointments and that they also conduct follow-ups to ensure that the client has no questions, comments, or concerns after their appointment. There are times when clients go home, or there are times when client interacts with a medical provider, and at the moment they tell the medical provider they don't have any questions or concerns. Once they go home, that's when they start thinking about, hey, I should have asked this, I should have mentioned that. The CHW reaches out to these individuals and they conduct follow-ups, and they're able to relay those concerns to the doctor and improve that communication between both individuals, the clinician and the provider. They also, as I mentioned, facilitate transportation services and help address barriers to these services. They also assist with completion of forms. NCHWs can provide monitoring to ensure patients are engaged in their care and making progress towards their goals. By providing ongoing support, CHWs can help patients stay motivated and engage in their health. CHWs also take the role of coaching and support. CHWs can provide behavioral interventions to help individuals adopt healthy lifestyle habits such as healthy eating, regular physical activity, and stress management. How to eat, they don't just tell the individuals how to do things, they also show the individual how it's done. And this is done through healthy cooking classes, as well as providing educational materials such as the Healthy Plate, where it gives a visual breakdown as to what is the portions that the individual should be eating. Through coaching and support, they also offer appropriate exercise routines, low impact, such as arm curls while watching TV, squats during commercials, or maybe encourage the individual to take a 15-minute walk in the morning and take a 15-minute walk in the afternoon instead of having all of the 30-minute walk at once. They also assist with the creation of SMART goals, which are your specific, measurable, achievable, relevant, and time-bound type of goals. CHWs can also provide peer support to individuals living with diabetes by sharing their own experience and providing encouragement and motivation to manage their condition. Down the line, we go ahead and come to the next one, which is advocacy. CHWs are from the same community as the people that they serve. They are aware of what the community needs and wants. They become the voice for those who are unheard. They can promote policies that will be beneficial to their community, and they make their organizations, local politicians, and their community aware of needs. Another role here is going to be building capacity, improve health literacy of the individual and the community. By building this capacity, CHWs are able to increase and improve health literacy levels, which then in turn leads to a healthier community. They encourage people to utilize available services before the situation escalates. In the case of diabetes management, they encourage the usage of preventive services, such as the ones that I mentioned earlier, going out to take care of your eyes, getting that annual foot exam, doing your A1C, testing your A1C, etc. We also move on, almost done here. We move to direct services. CHWs treat the individual as a whole. Not only do they provide guidance in diabetes management, they take time to understand other barriers the individual might be facing, either whether they're medical or non-medical, and point them towards the right source. CHWs can provide patient-centered care by understanding patients' unique needs and preferences. By taking the time to listen to the patients and involve them in decision-making, CHWs can help patients feel more engaged in their care. The eighth role that I have here in my list of 10 is going to be assessments. CHWs, when properly trained and supervised, conduct screening and assessments. They can complete questionnaire forms with the clients and explain to them the purpose of this. Sometimes whenever we are conducting those surveys and assessments, we don't get the client to answer all the questions, or we don't get them to be as involved. The CHW takes the time to explain to the individual why this assessment is being done and how it affects them. They also conduct outreach, which is they meet the individuals where they're at, whether they're at home, at school, health fairs, community events, etc. And finally, they assist with evaluations. CHWs can offer solutions to challenges that prevent programs from being effective. Effective patient engagement is an essential component of successful diabetes management. By empowering patients to take an active role in their own care, healthcare providers can help them achieve better health outcomes and improve their overall quality of life. Next slide, please. All right, so this should be a video that we're gonna go ahead and play for you guys.
If it doesn't end up working, Hansel, it could even be that in this, for the sake of time, Juliet put it in the chat. I don't know what you think about, we could post it on the Google site as well, the direct link, if it's not working.
Okay, this video that I was going to go ahead and share with you guys basically describe the situation of this gentleman who encounters that he has diabetes, and he explains the role that the community health worker had in helping him overcome this and manage his diabetes, and then also how the community health worker not only helped him change his life, but also encouraged his wife and his children also to take control of their health. So let me see, where we weren't able to play it then? All right, then as we mentioned, that link should have been dropped. Let me see. Maybe if I can share.
Thanks, Mark. I think it's that we have another person screen sharing, and it's through a downloaded file versus the Google site. So there's some mix-ups with technology today, but we will make sure that it's also also on the Google site and it's in the chat as well. So we apologize for that.
And there you go. Then you guys should still have an opportunity to view that video. It is a very good story. I enjoy listening to that story. So I encourage you guys to take some time. It should last maybe 5 minutes to listen to how the CHW affected the gentleman's his life. Next slide, please. All right, then we've come to our poll question. So this poll asks the following: which of this is not a role CHWs play in engagement, in patient engagement? So we discussed the different types of ways that CHWs, their different roles, and how they involve patient engagement. Which one of these is not something that a CHW does? So go ahead and take some time to answer the question. And as a reminder, we're looking for not a role.
And thanks everyone who responded. I shared the results on the screen. All of you are all of you are very sharp.
All right, so yes, you are correct. I saw that the answer that you guys selected was prescribed medication, and that is, as I mentioned, that is correct. CHWs are able to provide patients education. They're also encourage them to continue self-monitoring. They facilitate talks between the provider and the client, and they also promote healthy behaviors, but they do not prescribe medication. And this is, in general, CHWs do not have that role or that capacity to do that. Next slide, please. All right. So now that we have discussed who CHWs are and their core roles, we're going to go ahead and look at how they can assist with emergency preparedness and management. When disasters occur, underserved communities tend to be hit the hardest. These communities are already experiencing an array of barriers to health. Emergencies tend to exacerbate them. An emergency situation can occur without notice. The following are some examples of these. So we have emergencies such as natural disasters, and this would be earthquakes, tornadoes, hurricanes, floods, droughts, snowstorms, fires, anything in that regard. We also have emergencies in the form of pandemics. So the most common one that we all are aware of is that COVID-19, right? Another type of emergency preparedness that CHWs can assist with is going to be for chronic disease, diabetes, obesity, substance abuse, heart disease. You also have emergencies in regards to foodborne illnesses, such as E. coli, Listeria, Salmonella. Most recently, I'm not sure if you guys saw the news, but I believe Costco was recalling some of those strawberries because they had hepatitis A. So a CHW would be someone that can go out into the community and explain to their community members what they should be aware of. And you also have emergencies such as non-health emergencies, emergency housing, assistance with bills, maybe food pantries. CHWs are invested in their communities and can help the community return to a sense of normalcy after a disaster occurs. Next slide, please. Some emergencies may affect certain groups, especially underserved populations, differently within the community. CHWs ensure that these individuals are not left behind. CHWs play a role in all three stages of emergency preparedness and management. First, we're going to go ahead and touch on the role that they play before the emergency or getting ready for that emergency to occur. Things that the CHW or the role that they would play here would be they assist individuals with preparing plan of actions. So for those who have diabetes, CHWs can provide a list of items that they need to make sure they have at hand. And for all others, they can provide general instructions on how they should go about the situation. They're also out in the community offering resources, things such as sandbags, letting individuals know where to find shelter, providing list of organizations that are aiding the community. They also can assist in collecting information. This can be census information includes where the individuals live in the community, what houses have individuals that might have a chronic condition they need to be looked at after, maybe also figure out where there's individuals that might be pregnant, individuals that might be elderly, handicapped, or lack transportation. A community health worker can go ahead and assist with mapping all of this information out so that the organization knows where they should go and target individuals. And they also assist with mobilizing community's response. They ensure the community is aware of the dangers and they encourage the community to take preventive measurements. So what is their role during these disaster? Well, during the disaster, they serve as a point of information. CHWs, if the individual doesn't know what's going on and they don't know where to get their information from, they can turn to a CHW who will be able to provide them the information that is needed so they can understand what's going on and what they need to do in order to stay safe. CHWs also connect community individuals, they connect clients with community partners. They do this through a warm handoff. So not only do they let you know that this location is where you need to go ahead and go for assistance, they provide you a warm handoff. They'll explain to you where you need to go, who you need to talk to, and what to expect. It has been proven or has been seen that whenever you are offering resources, if you offer the resource through the warm handoff type or method, they're more likely to take on that resource and utilize it versus you just letting them know, go to this place and you can go ahead and find assistance here. And they also provide education and dispel myths. They provide accurate information in a culturally appropriate manner. Going back to the most recent COVID-19, CHWs were out in the field, letting the community know and dispelling myths that they might have had about the vaccine. Things such as maybe that the vaccine was using baby cells, all that type of misinformation that was spread out. CHWs were out there in the community dispelling and letting the individuals know what is actually happening versus what is just myths. After the emergency, community health workers can assist with screening and assessing. They can go out in the community and assess the situation, assess the needs that the individuals have. They can also create support groups. They are not licensed to provide therapy, but they can go ahead and provide support groups where the individuals that were affected can get together and discuss different ways or methods for them to overcome these challenges or what might be some things that are stressing them and making them feel unease. They also provide information. As we keep saying, they do this in a culturally appropriate manner to ensure that the individuals are digesting the information and they're not just receiving another flyer. They also inform community members of the available resources. So after emergencies, there tends to be a fluctuation of resources, but individuals do not know where to look at. This is where CHW can come in and point the individual, as I mentioned earlier, through a warm handoff to where they can go ahead and find assistance. And they connect with the community and key partners. Next slide, please. All right, so this is a question for you all. Does your health center include CHWs in your emergency preparedness plan? So we want to know if you guys have a preparedness plan. Do you utilize CHWs in that?
Yeah, thanks, Mark. Yeah, I'm going to give it 1 second before I close the poll, but I see a lot of yeses, so I think it'd be great to hear from folks and their experiences here.
Great. I do see that we had a good amount of individuals say yes. Would any of you guys like to come off mute and share with us how is it that you're utilizing CHWs? Maybe was it a different way that I mentioned myself? Are you using them the same ways that I also presented? We want to go ahead and hear what you guys have to say. Yes, Mark.
I think one of the most important parts of this is the reviewing that you're doing, because as a FEP coordinator here in our county, I forget some aspects of the people that are, affected by social determinants of health. And this is one of them. It was very important for me to get online with this and start your processes to help me understand what this cohort needs, so I can include that in my FEP plans moving forward. So I really appreciate everything you covered on this, and I'm sure everything else we're going to be doing moving forward.
Thank you, Mark. Appreciate it. Does anybody else feel talkative and want to share with us today? All right. Well, thank you for answering that question for us. I wanted to go ahead and get an idea as to what you guys' usage of CHW is, and it seems that the majority of you guys either do have CHWs and are including them in some way, which is great. That means that you guys are trying you're not forgetting about those unheard voices. You're trying to reach them as well. Next slide, please. All right, so now we're going to go into some little case scenarios. The following are real life situations where organizations, whether they were state organizations or they were schools, utilize community health workers to address an emergency that occurred. I'm going to go ahead and present to you guys a little snippet of what's going on, and then we're going to go ahead and open up to try to figure out what are some ways that the CHW can go ahead and assist in this situation. So next slide, please. All right, so our first example here is going to be that of COVID-19. And what do I have any volunteers to read the passage?
The emergence of COVID-19 has presented significant challenges for the state of Maine. After detecting its first case of COVID-19 in March 2020, Maine activated its entire public health infrastructure to quickly identify, investigate, and isolate COVID-19 cases. While responding to the emerging virus through testing, personal protective equipment, distribution, and contact tracing, Maine has also began its planning for the eventual approval of a vaccine or vaccines for the prevention of COVID-19. What do you think would be the role of the CHW in this situation?
And as a reminder, we are looking at towards the end, so I know it was a lot of information, but we are focusing on that last part where it says Maine also began its planning for the eventual approval of vaccines for prevention of COVID-19. So how do you guys think that Maine utilized their CHWs to encourage those vaccines? And we can go ahead and switch to the next slide. That's going to go ahead and show us a breakdown again of all the core roles that CHW play, and we can go ahead and use those to try to come up with an answer for this. So looking at that list that is right there in front of you guys, what are some things that CHWs, or what are some of the roles that CHWs would be used in this situation? What do you guys think? Would they be someone good in providing culturally appropriate information? Would they be used?
I especially think during the stage that you referenced in the case scenario about before the vaccines were developed completely, or while they were in the process, there was there still is, but there was so much misinformation and there were so many concerns in general. But I think that culturally, it makes a ton of sense to have folks who are trusted members of the community be able to pass along those real-time updates, which even the medical community was kind of overwhelmed by how much things were changing, how confusing it might be, but really important since there's so many, there were so many ways that folks were getting, hearing rumors about vaccines or hearing rumors about COVID-19 itself. And so just having someone they can look to trust for that updated information, I think would be fantastic.
Thank you, Ariel. I see someone answers on the chat. Identify community members who might have comorbidities or underlying health issues related to diabetes. Yes, so they would be, because they're from the community, they have an understanding of who needs that assistance and how to better provide that assistance to those individuals. So not only would they be, let's see what they have, educate, identify vulnerable populations, achieve trust by keeping community up to date with accurate and correct information. That is also a great way that CHWs assist. Thank you, Francis. All right, we can go ahead and switch to the next slide. So the next slide here provides, lets you know what were those roles that the CHWs played in this situation. So once once Maine decided to go ahead and start utilizing CHWs to pass out information on vaccines, some of the roles that the CHWs played were cultural mediators and also individuals that provided culturally appropriate education. They acted as a bridge between the healthcare providers and the community. They understand the fears that the community has over the vaccine, so they were able to better address those. And they're able to explain to the clients the benefits in a culturally appropriate manner. They also were involved in some social support, not so much coaching, but more the social support in regards to encouraging others to take preventive measurements. They also had a role of outreach. They were going out into the communities and informing their neighbors about COVID-19 and the vaccines. They also had a role in building capacity. They provided this information to the community so they, in a culturally appropriate manner, so that they would be able to take charge of the situation and make better health decisions. And they also assisted the individuals with navigating the system, finding out where the vaccine is available, where they can go to get that vaccine. Things that they weren't mentioned in the guide that they were utilized, but that CHWs still might have a role, would be in advocating. They did not use CHWs to advocate for the community, but a CHW could advocate for their community by requesting more vaccines, by letting the organization know where the need is at. They also were not used for evaluation and research, but if they were needed to, CHWs would be able to provide some insight into the data that's being gathered, explain to them why maybe this is not being accepted or why this is being utilized more than something else that isn't. They didn't do, in this format, they didn't do much direct services because they weren't out in the community giving that vaccine, but they were encouraging individuals to go and get that vaccine and letting them know where it would be available. Next slide, please. All right, so here we have another situation, another incident, and this is going to be regarding oil spills. And I'll go ahead and read this one for us. So it says, the University of South Alabama's Coastal Resource and Resiliency Center trains CHWs and places them along the parishes and counties of Louisiana, Mississippi, Alabama, and the Florida Panhandle. It is believed that these lay workers could mitigate the effects of future disasters, such as oil spills, by encouraging preparedness, enhancing community resilience, and facilitating disaster recovery. And again, the question that I present to you guys is, what do you think would be the role of the CHW in this situation? And I kind of already gave you a glimpse of what the answer might be in that last sentence that says that they are being used. Well, I'll let you guys try to guess that one. So what do you guys think their role was? And we can go ahead and switch to the next slide so they can see the roles. There you go. And for the sake of time, I'll go ahead and if we want to go ahead and switch to the next slide, and I'll give you also an overview as to what their role was in this situation. Just like it was in COVID-19, the role that the CHW played in this situation was also as a cultural mediation and also culturally appropriate in providing culturally appropriate education. They provided information, or they provide information in a language that is understood by all their community. They also were involved in doing outreach. They were out there informing the community of the possible situations and how they should react to those situations. They also were out in the community building capacity. They provide the community with the tools to make better health decisions, and they teach the community how to stay prepared. They were also involved in system navigation, pointing the community to available resources. In this case, they were doing more direct services. They were assisting those who suffer of chronic conditions, those who developed them during the disaster, and for those whose conditions might have exacerbated due to the disaster. And they also provided more of a social support, not so much coaching, in the sense that they were out offering resources to that community. Next slide, please. All right, so those two were little case scenarios where CHWs were utilized for emergencies. Now what I'm gonna go ahead and provide to you guys is some resources. This guide here, or the purpose of this guide, is to assist centers and partners in identifying the roles of CHWs in addressing diabetes. This guide will provide access to information that will facilitate the identification of CHWs in the health centers and their roles in addressing diabetes self-management and prevention in their communities. So this little guide will give you a whole breakdown as to what is it that the CHW can go ahead and do, what are some activities that they can also offer. Next slide, please. And this information is free for you to download. It's just a matter of going into our website. The following resource is available in English and in Spanish. And this resource, so we spoke about potential complications on the previous sessions on session number 2. These resources provide educational prevention tools that community health workers, CHWs, can use and share with migrant seasonal agriculture workers and other vulnerable populations to reduce diabetic health complications. There are several downloadable resources available to guide CHWs on risk factors and prevention methods in oral, eye, and foot health complications, which are commonly linked to diabetes. So as I mentioned, this little resource gives information and guidelines for CHWs as to how they should provide information to their community on eye care, provide information on oral care, and also on foot care. And it is available in our website, free to download, and it's also in English and in Spanish. Next slide, please. And the final resource that I have here to share with you guys is our resource called Including Community Health Worker and Outreach Workers in Health Center Emergency Preparedness and Management. So stay informed. This tip sheet focuses on how outreach workers can support 3 of the basic emergency management expectations for health centers, including emergency management planning, linking and collaborations, and communications and information sharing. Next slide, please. All right, and at this time, we have come to our evaluation time. So I asked you guys to take maybe a couple of minutes to go ahead and answer some of these questions for us. The purpose of these questions is to ensure that we are bringing the information that you guys need and that it is beneficial to you guys.
Thanks, Mark. Yeah, if you're able to quickly fill out the poll, we won't share the results of this one if you're new to this series. We ask these quick questions for every session. We leave a few minutes at the end of the hour. We'll do a bigger evaluation at the end of the series next week, but helpful to get just little points of feedback. We'll leave this open for another minute or two. Definitely understand that folks have other things to do. While we're keeping this open, Chantel, can you go to the next slide? Just for those who are still here with us and those who might be watching the recording who weren't able to come to today's session live, we have one more session left together. Juliet will be in touch with reminders next week. We know things get really busy, but I'd really love to see you all back next week as we're going to be reviewing, relevant resources for diabetes emergency preparedness, thinking about, how we're personalizing that for our priority patient populations. Hansel mentioned a few things around health literacy today. We're going to focus on that a bit next week. And in general, just make sure that you all have what you need to move forward in improving your programs and services with emergency preparedness for those living with diabetes in mind. So thanks for those who filled out the quick poll. That's going to be that. We can go to the last slide, Chantel. Our emails are on this slide. You also will receive emails from our National Center for Equitable Care for Elders and Juliet's email as well. So lots of points of contact, but if you can think of any questions from today's session that you'd like to pass along to Hansel specifically, or anything around this topic that you're hoping to still learn, feel free to email us. And again, next week we'll have some opportunities for discussion on where we go from here. So again, thank you for your time. Thanks, Hansel, for your facilitation and content today. And we are looking forward to wrapping up this series next week with you all. Thanks so much. Have a wonderful rest of your day.